Assalamu alaikum. Today is communication day. We will start with this scenario. Mrs. Hala or Miss Hala, 28 years, newly diagnosed with Addison. You are the senior house officer in the endocrine clinic. Discuss about diagnosis and management plan. We will start after the time share. Okay. Ready, Dr. Rasha?
Yes.
You can see the timer?
Mm-hmm.
Yeah, here you go. Dr. Abdullah.
Yes, no.
Okay. Hello.
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 Hi.
Good evening. My name is Dr. Al-Mahdi. I am doctor in the clinic today. Can I confirm I am talking to the Mrs. Hala?
Yes, doctor.
Are you? Yes. Are you 28 years old?
Yes, I am.
Mrs. Hala, do you wanted anyone attended to our meeting today?
No, thank you.
Okay. Mrs. Hala, what do you know regarding your condition?
I know that I have been complaining, doctor, of this feeling tired so much. And it's quite bothering. Please help me, doctor.
What do you expectation from our meeting today?
I expect that you help me a lot with the treatment and tell me what's happening.
Well, Mrs. Hala, as understand you, you suffer from the tiredness since long time. Some
Okay.
investigation was done for you. I'm really sorry to hear that. Is not as we hope.
Okay, doctor, what's happening?
The investigation that reveal you have a condition is the called Addison disease.
Okay.
Have you ever heard about that before?
Yeah, I heard about it. It's just it's something very common. I saw it in my cousin. Yes. Well, so what's happening briefly, doctor?
Do you want me explain more about your condition?
Yeah, I know a little bit, but I would like to hear some of your information too.
Yes. The Addison disease is the medical term for the medical condition due to the disturbance in the defense system was supposed attacking to the body, but your condition attacking to the gland located above the kidney, leading to decreased release in the hormone, the protein, which they called into the medicine steroid hormone, leading to the symptoms such as tiredness and lose weight and lose the appetite and symptom of low blood sugar. Are you follow me?
Okay, doctor, I'm confused. What is a steroid?
Yes, the steroid, which the hormone.
Hello, good evening. Your name?
Yeah.
You are from?
Yes. The steroid, which the steroid, which the protein is secreted from the gland, is located above your kidney, which are responsible a lot of the function to our body. In your condition, the disturbance in the defense system, which attack the gland, leading to the decreased secretion of the protein, leading to the symptoms such as decrease the weight and decrease the appetite and also feel tired all the time and decrease the blood sugar. Are you following me?
Yes, I'm following you. Yes. So, doctor, does that explain my feeling so much dizzy? So how can you help me with that, doctor?
And highly appreciated your concern. You need first of all to make the group specialist include our consultant and specialized nurse and psychiatric to start and social worker to start the treatment. Our plan to start the main treatment of this disease started the hormone started the medication by the oral therapy.
Okay.
I'm sorry to tell you that. Is it serious if left with untreated? For that, you needed to restrict adherent to the medication to avoid the complication that may happen if you stop the medication.
How much serious is that?
Your worry is understandable. If you don't take in this medication, may be affected in your blood pressure and your blood sugar, and even may be affected into your life and shorting your life. For that, you needed to start the treatment as soon as possible and continuous the treatment for the long life.
Doctor, so what is the drug?
This the drug is the hormone replacement therapy, which meaning you need to take the steroid as the oral tablet for long for all of your life.
Okay.
And also needed to the regular follow-up as the outpatient to sure this the hormone to sure this the hormone level and offer to you the full care.
Okay.
And Mrs. Hala, I want to discuss with you some issue regarding the medication. This steroid, if you have any fever, or if you have any or feel any sick, high body temperature, or you feel any sick, you needed to doubling the dose.
Okay.
Mrs. Hala, and also you need to use the medical bracelet to know your friend and your family and your GB about you have Addison disease.
Okay.
I can ask you some questions.
Sure, doctor.
Are you have a partner?
I am married, doctor. Yes, I have actually I'm having one child. Yes, and we are happy.
Yes. Are you planning for pregnancy?
Yes, doctor. I'm expecting that next pregnancy maybe soon.
If you're planning for the pregnancy, you have to inform the gland doctor and women doctor to make a group specialist for you to provide to you the proper management plan during the pregnancy.
Great. Yes. Okay.
Mrs. Hala, do you have any other concern?
Yes, doctor. I heard that actually I'm afraid about this drug. You mean steroid? I had my grandmother died after taking steroid.
I highly appreciated your feel, but this the steroid is given to you. The steroid, as any medication, maybe have some complication, but like high blood pressure and high blood sugar and stomach soreness. But regarding your condition, the steroid is given to replacing the normal level of the steroid, which that you needed, and if this any complication is happening to you, we will manage it and when both the benefit and the risk of the steroid regarding your condition, the benefit is more extreme than from the harmful.
Yes. Okay. Great.
Do you have any other concern?
No, doctor.
Can I ask you some social questions?
Yes, doctor, sure.
What are you do for living?
Well, I am just a housewife at the moment.
How much these the symptom affecting to the daily activity?
Well, it's making me on the bed most of the time.
I am sorry for that. I will refer to the social worker to help you regarding the issue. Do you smoke?
No, doctor.
Do you drink alcohol?
And I don't drink, no.
Mrs. Hala, can you tell me how much you get from our meeting today?
Yes, I get that you are giving me treatment that because I have Addison disease, and that is very important medication to take and to continue on, and steroids, yes, and that they have some side effects, but the benefit is outweigh the risk. And I should also, if I have any infection, I should be careful and increase the dose. And uh, that this, if any, also pregnancy, that I should also seek a pregnancy doctor.
Mrs. Hala, do you have any other concern?
No, doctor, thank you.
I am also, I will give you some leaflet and brochure to reading more about your condition. If you have any query, please do not hesitate to contact with us.
Sure, doctor, thank you. Yes, Dr.
Perfect, Dr. Rasha. Perfect. Yes, you finished on time. You did everything really on that unfortunately.
Yes,
So,
perfect. You
let's hear
explained
Dr.
about,
Abdullah. Yes.
yes, so Irish or UK?
UK.
Okay, so no discussion, I think, right here.
Yes.
So
Alhamdulillah.
you explained about the disease well, and you explained that there is so that in this case there is a lack of essential hormones that need to be replaced from outside. But you said some jargons. You started with the steroids, and you didn't explain to me the steroid, and you mentioned psychiatry. And
Yes.
psychiatry may be not needed in this case, unless the patient is really affected, I think, by his mood. In this case, you explained the pathogenesis well, but you didn't make me interested well in the medication. You should tell me that this is you have in order to live well life without all your symptoms. You will live great life if you take a medication that we're gonna be replaced. And then he will ask, oh, what is that, doctor? Can you tell me? Okay, sure. That is an easy replacement. You are going to take bare mouth. This we call steroids. So steroids, don't bother with the term. It's medication we're gonna give in. We may give two forms depending on the assessment. We will give prednisolone, and also we may give something called fludrocortisone. So prednisolone and fludrocortisone, and these medications are very important to be taken on a regular basis and not to miss any dose, because your body will not tolerate any missed dose, and you will have a risk of a crisis. And you explained that this is a life-threatening condition if not treated well. Good job. And you explained also the need of doubling the dose if any infection or any vomiting or any fever, and importance to seek medical advice. The bracelet and the crisis, and then you went through the pregnancy and job, and also you went on the social history. Well done. Yeah, basically that's, I think, the main scenario. And you saw all the concerns. Good job.
Yes, thank you, Dr. Abdullah.
Yes, thank you, Dr. Abdullah. Well done, Dr. Rashid. So it's as I told you, you're afraid from, but you did it in perfect way. I'm reassuring you that you did everything in this scenario. The only thing I wanted you to talk about and to clarify to the patient that the steroid in her situation is replacement, so no risk and benefit. It's the to be the main and to be the replaced part of her deficiency. It's not over intake or something will have side effects. It's to replace the no the normal or the needed hormone in her body for the metabolism and catabolism. So the risk and benefit, it's not like if the patient is diseased and he will take the steroid for something like inflammation or rheumatological condition. No, in her condition, she's taking as replacement. So no risk and benefit. All what she will get the benefit, no risk because this is the replacement. In the other arm, if the patient is diseased with any rheumatological condition, he will take steroid as treatment, not replacement. So the side effect might appear, but in her condition, no, the side effect will appear if she missed the dose, not if she took the dose. Okay. So it's not the risk and benefit issue. It's like mandatory to take the replacement of her deficiency, which is steroid. So no risk and benefit. It's all benefit, no risk for her. She will not develop osteoporosis. She will not develop infection. She will not develop so what's called peptic ulcer or any complication. This is the point. I think
Okay, thank you.
no guts protection for this. I think so. Why she will take gut protection? Maybe she will take. Yes, you're right. Maybe she will take gut protection because she's taking oral steroid. Okay. Yes, maybe. But what I know that the patient will take steroid as hydrocortisone and oral, and as you said, lifelong. Okay, so let me repeat what you did, Dr. Rasha, just to teach and also to comment and give you the positive feedback what you did. Okay, you started introduction, introduce yourself, confirm the patient name and age. Do you invite? Good, because she will get some breaking bad news, what you know about your condition and the expectation. Then you start to explain the disease, and you told her the result with me, and you give her the shock news, which is Addison. You have what we called Addison, and you start to explain the Addison. And the good thing, you ask her, did you know about Addison? She said, yes, I read and I read about it. Then you give her another question. You want me to explain more? Yes, very important this question. Why? Sometimes patient will know, and you just talk and in an unnecessary way, and the patient know everything about disease, and he want or she wants you to explain something which is her need, not your need. You need to explain, yes, but she might know everything, and she doesn't want you to explain this information. She wants you to explain a management plan, for example. She doesn't want you to explain about what she has or what he has. So good thing to ask him. You want me to explain? You want me to talk about management plan? Whatever he want, do it, because sometimes you are wasting time. Then the patient will tell you, yes, doctor, I know everything what you said and about what you said, and I want only to know about management plan. So you waste time for something she knows, and you will, for example, you will not have time to explain what the patient needs. So try to ask this question as Dr. Rasha did. You want me to explain something? You want me to explain the disease? You want me to explain the management plan? Do like this, okay? Then you start to explain in simple way a defense system attacking the gland above the kidney, then the hormone, or as Dr. Abdullah said, steroid as jargon, but you can say substance or protein secreted by this gland and leading to your signs and symptoms in the form of tiredness, low appetite, low blood sugar, then feeling dizzy. Yes, she asked you about dizzy. Doctor, this is explain my dizziness. You told her I will explain you and I will add and involve multidisciplinary team, but you should address this concerns particular. Okay? She told you, doctor, that's why I feel dizzy. You should answer this question. Okay? Don't tell her another answer. Just a minute. Okay, sorry for interruption. Then this is a first concern, you should answer it. Okay, then you told her about multidisciplinary team approach. Agree to involve whatever any team you want to involve, but address the concern first. Okay, after this, she give you another concern. Is it serious condition, doctor? You answer here in honest way. Yes. If you didn't take your steroid, you'll be in a life-threatening condition. It might shorten your life. Agree for this sentence. Even it's like warning one, but it's a real one. So you should be honest with the patient. Then the drug, yeah, you explain about, she asked you what drug I will take. You told her you will take steroid as a replacement per oral, lifelong, and you need frequent follow-up. Excellent to mention the follow-up here is very important. Why follow-up? To check your steroid level, to check your signs, your symptoms, your progression of the Addison. It's very important. And to show the examiner that you are caring for your patient for the welfare. Then if you feel fever, sick, or any infection signs, you should double the dose. This is good alarm. And the bracelet, another alarm, which is very important here. The family member also to be aware about your condition is very important. Then he gave you steroid complication as a concern, and you told her it's risk and benefit. But as I told you, it's not as taking the steroid for certain disease. Here, the steroid as replacement for the natural one. But it's not natural, but it must be replaced by the steroid because our natural steroid is defective or missing due to some problem on the gland. Then, yes, the social, very important, the job, the smoking, the alcohol, and the impact on the job. Then the last thing, you ask her to recap. It's okay here, no problem, because it's very important meeting and the decision for management plan as lifelong medication should be repeated by the patient to understand or to check her understand about the disease and the management plan. Then the literature brochure. So what you did, I will give you full mark to Rasha. Don't worry, you can do it. Any scenario you can play with, as you did in this scenario, okay? Sorry for talking long. Yeah, thank you. Give Dr. Abdullah the case, please. Write in the chat box.
Okay. Okay.
If anyone has any comment or question, you can ask. Yes, right, Dr. Rasha.
But just I have 2 comments again.
Sure. Yes. This is your case.
Is it a protein or lipid? We are not sure. I was trying to get this information before starting the adrenal hormones.
Protein or what?
Is it correct when we say proteins in adrenal hormones? Are they lipids from lipid? Or I'm not sure.
Actually, to avoid the jargon, you can put any simple word. That's why I said substance. Some mentors saying protein. Anyway, try to explain in more simple way. If you said steroid, tell her what the steroid means. It's a product or some protein, some substance which is secreted from this gland. Try to explain the jargon by another word which is more simple. Even a psychiatrist, I don't think patient here need the psychiatrist. So, but if you want Dr. Rasha to invite psychiatrist, you can say mood doctor. So try to avoid any jargon, or to say the jargon, then immediately explain what is this means. Okay.
Yes, excellent. But it's just the empathy and sympathy also. I think it will be better.
Yes, some more clinical indicators.
Dr. Raja, can you put the scenario?
السلام عليكم.
عليكم السلام ورحمة الله.
If I comment, I can comment. She's well done, Dr. Rasha.
Sure,
But
Dr. Ryan,
I
yes.
think in any chronic illnesses, whenever there is acute presentation like crisis or flare, we have to explain to the patient when to go to emergency department. The symptom of acute presentation, I mean crisis or flare, and also to discuss hydrocortisone as emergency kit at home injection. She mentioned the double dose, but if there is any injection to take, because sometimes the patient will develop vomiting as acute crisis, so she cannot tolerate the oral. We have to discuss with the patient to keep injection and to teach her
Yes, excellent.
when she can take that one and when to go to ER.
Perfect. Yes, yes, excellent, Dr. Ryan. Even in the multidisciplinary team approach, there is what's called specialized nurse. This specialized nurse always in the team. Why? Because she will educate any patient how to take and how to inject, how to use. Yeah, yes, you're right. I agree 100%.
Yeah.
Thank you, Dr. Ryan. Any other question, Dr. Zain? We can add welfare cortisone ampoule in her bag in case. Yes, yes, I agree. Also, still a point. You can add cortisone in case the patient has any vomiting and she cannot use the oral route, can be inject herself, or to teach her family member how to inject her. I agree, the same point. Yes. Okay, Dr. Abdullah, read the scenario loudly, then take 2 minutes.
Yes, sure. Miss Muna, 35 years. She complains of frothy urine, I think, and puffiness in eye. Diagnosed as nephrotic syndrome, nephrologist consult decided to renal biopsy to know the staging of her kidney disease.
I'm sorry, he is now case of systemic lupus.
Okay. Dr. Rasha, I am a doctor just in the hospital.
Yes.
Okay. May I start?
Okay, I will share the timer. Then you can. Okay, you can start now.
Hello,
Hello.
my name is Munla. I am one of the doctors here. May I know this is Miss Muna and you are 35 years?
Yes, I am.
Nice to meet you, Miss Muna. We are
Nice
here
to meet you.
actually to discuss about your health condition. May I know if you want anybody to attend with us?
No.
Okay. Miss Muna, what is your idea about our meeting?
Yes, doctor, actually, I suffer from I think as disease is called systemic lupus since 3 years ago. Since yesterday, doctor, I feel my waterwork is become more white and frothy. And also, doctor, I noted my face is become more buffy. Doctor, I am very worried. I want to know what happened to me.
And okay, I'm really sorry for what you are experiencing. We are here to address everything and to help you. Is that right?
Yes, thank you.
Could you tell me what is your expectation?
I don't know, doctor, but I am very worried, doctor.
Okay, Miss Muna, actually, we run the investigations and it appeared that you have a condition called SLE, lupus. Don't bother with the medical term. It means that a medical term meaning that your body's fighting system is misdirected toward your kidneys instead of your outside germs.
Yes,
Is-
doctor, I know that because I diagnosed it since 3 years back.
Okay, I'm sorry for repeating that, but I want to confirm for you that this diagnosis is quite dangerous when affect the kidney. And for that, we need to run more investigations. In
What
our
do you mean, doctor?
our kidney consultant decided to do some sort of invasive procedure. This is called to take a piece of your kidney. At this, let me explain more. Please ask me if anything is unclear or vague.
Yes, doctor. Doctor, now my kidney is affected by systemic lupus.
Yes, so I will explain more. Your
Yes, doctor, please.
your symptoms of frothy urine, the swelling around your eyes, and all of your symptoms are found to be the kidney affected by this SLE, this condition. This condition really essentially, in order to be managed well, we need to take a tissue piece of your kidney. And in order to be able to take that tissue, we need to insert a needle under specific conditions. Let me draw for you. Is that all right, Miss Muna?
Yes, doctor, please.
So here is the kidney. Imagine that this is a kidney and you have there under specific conditions, we will insert in the back. So in sterile condition, let me explain to you the environment. So you will be prepared, you will be investigated before that for your blood pressure, you will be tested for all your vitals, you will have investigations done. And then when you are chosen for that biopsy as a safe procedure for you. We will have our consultant who did this procedure a lot. He is expert in his procedure. He will.
Doctor, what do you
Yeah.
mean by biopsy? I can't understand.
Yes, I mean the tissue, this procedure called the tissue, when he takes a tissue piece of your kidney. So, well, inside, you will be prepared, and then you will go inside a specific room, sterile, and you will be prepped, and with a specific gown, you'll be dressed, and a specific team will gonna assist you and monitor you. A needle will be inserted in that kidney to take a piece safely, and then this piece is gonna be tested under the microscope. Oh, are you with me?
Yes, doctor.
So this piece of a tissue of the kidney is after taken from your kidney, and then you'll sure you will be numbed. You will not feel a pain. Something will be given in your blood channels under the in the blood to not feel the pain for the procedure. And then after that, you will be in the recovery room. Part of that is that this piece is very important for knowledge of the stage or type of this disease in order to be helpful for your management. It's very important to help us in the choosing in the appropriate drug that to help your case. Are you following me?
Yes, doctor. Doctor, my condition, is it serious?
Yes, in your case, in order to know it's serious condition actually. And in order to be able to figure out how much affection in that kidney, we need to do that tissue diagnosis and see it under the microscope. This gives us a good idea how much severity is affecting your kidney and how much depth affecting your kidney. So a diagnosis after this tissue diagnosis, after the results, is going to be a better talk with you and discussion and a better idea of how much severe is your condition. Is that all right?
Yes, doctor.
So there are some complications actually of this procedure, that it may lead to higher blood pressure after that, but we will be monitoring you very carefully. And also we may in some cases lead to some bleeding, or it may lead to infection, or it may lead in some cases to further kidney damage. But in good hand and specific precautions, very good precaution measures, that is very seldom in our practice. Is that okay with you?
No, doctor, I can't do it. There's
Could you
any
tell me
alternative,
why?
doctor? There's any alternative?
Could you tell me why?
No, doctor, because you said there may because more damage and more can cause some bleed. No, doctor.
Actually,
There's any alternative?
well, at the moment, it's very it's quite important in your case. We can't say that this is something is harmful to you. I am telling you the very little percentage of these adverse effects of the procedure. And that doesn't mean that every procedure has acquired side effects or complications. In your case, that we will be very careful, and our team has done this very a lot. And so in this case, we do not expect these from happening, but they may happen, but that's in a very seldom percentage.
Doctor, when you need to do this procedure?
We can assess on you, and we are preparing you, and we can't have a specific time.
Can give me time to thinking about that?
Sure, yes, I will give you time to think and discuss with your relatives if you want.
Yes, doctor.
Is that all right, Miss Mana?
Yes, doctor.
Miss Mana, can I ask you, do you have any other concern?
No, doctor, thank you.
Miss Mana, may I ask you other questions I ask many of my patients? Do you take any blood thinner medication?
No, doctor.
Do you take aspirin or a drug called clopidogrel?
No.
Do you smoke?
Yes, doctor.
How many cigarettes and for how long?
2 cigarettes per day.
Okay, well, smoking is quite adversely affect your condition, and we advise you to stop, and we may provide you help with that.
Yes,
Do you
doctor.
drink, Miss Mana?
No, no.
Okay, Miss Mana, and could you tell me what do you do for a living?
I'm a teacher.
And how much this impacting you, your condition on your
Yes,
job?
doctor. So much.
So, Miss Mana, actually, we are here to help you for your best life level of living, okay? And we may provide, so after treating you, we will see the need that you're requiring at home. Is that all right? If you do have any.
No, doctor, I don't need.
Okay,
Okay. So,
okay,
Miss,
Dr. Abdul. Yeah,
yes,
time is up. 2 minutes. I added 2 minutes for the last and social and the consent.
you didn't tell me 1 minute left.
Oh my God, you are not seeing the screen? Okay,
No.
sorry. Next time I will allow for the timer. Okay. Let's hear
When
from
it is left?
Dr.
Oh, 2 minutes.
Sorry?
Okay.
Yeah, the screen is there. 12 minutes now. 12:45. Okay,
Okay.
let's yeah. Well done. Let's hear from Dr. Rasha. You comment, then I will comment. Okay.
Yes,
Start,
well
Dr.
done, Dr. Abdullah. But I think this patient now, a newly diagnosed patient already, she is systemic lupus, not needed to repeating explanation again. You should ask the patient, you wanted me explain more about systemic lupus?
Yes.
And the second, I think the patient now is presented with the lupus nephritis. You need to discuss about the lupus nephritis. You mean the systemic lupus is affected in your kidney, causing your symptoms such as puffiness in your face and the frothy urine.
Yes.
The second, you tell me biopsy.
Yes.
And microscopy examination.
Jargon. Yeah.
I don't know if the tissue is jargon or not.
Yeah.
The third, there's no any sympathy or empathy.
Okay. What is the relative? What is the alternative of tissue?
I think taken snip, small piece.
I don't like
not
the
tissue.
word.
I think tissue is not jargon, but I don't know other word.
Is a piece a good word?
Yes, maybe bees.
Okay, okay,
Mhm.
okay. Continue, please.
Yes, there is no sympathy and empathy. And when ask you when we needed to release the procedure, you say you can do it at any time. But I think this patient needed to do the renal biopsy as soon as possible.
Okay.
And also ask me the history about if the patient took aspirin and warfarin. I think there's no history in communication.
Yeah.
And last, not ask the patient about the consent.
Yes. Actually, I forgot.
Mhm.
Yes, I was remembering,
Yes.
but yeah, I missed it with this. Okay.
Yes, it is important the consent. But overall, يعني, well done.
Okay. I found a struggle actually to convince you. And could you tell me how to convince you better with the procedure? Sure, there
Yes,
was
I think this the patient you needed to do this the renal biopsy to know in which is the stage the systemic lupus is affected in your kidney. Regarding this the stage, we can decide the treatment, which the type into the treatment, and also with the renal biopsy can do the regular follow-up. After that, we can do the regular follow-up to know if this the treatment is affected in your condition or not.
Sure.
Mhm.
Thank you for a good feedback. Thank you.
Welcome.
Thank you, Dr. Rasha, for the case. Well done, Dr. Abdullah. Let me start
Thank you.
from in a brief.
Yes.
So the introduction, the confirmation of the data, the patient name and age, the invitation, the idea about the disease, the expectation. You did the introduction very well. But when you explain as Dr. Rasha said, you explain SLE. She is known case of SLE. Either to ask her, you want me to explain about your original or your disease or no. If she said no, because she knows about SLE, but now she came with nephrotic syndrome. You didn't say any word including this complication, either SLE as lupus nephritis or nephrotic syndrome. And this is the current condition. She came with this. You you explain the previous condition, which is SLE defense system attacking your body and fighting the body instead of the bugs. Okay, if she asks you to explain, you could do that. But if she knows, so either to ask her if you want me to explain about the disease or you want me to explain about the current condition or the SNP itself as a procedure. This is your task in this scenario. The scenario is procedure. It's not counseling about disease or complication. It's a procedure. That's why the time was already wasted without finishing the consent issue. Because you start to explain the disease, and the main task here is the procedure. You kept explaining the procedure well before and during and after. You did everything. But I wanted you to start by this from the start, not about the condition or the SLE. Or if you want to tell about nephrotic syndrome as complication, that's why our consultant decided for the SNP. Okay, this is what I know about the word, appropriate word for the biopsy is a SNP. No tissue, no piece, no biopsy, only SNP. This is all mentors, yes, agree to say this word. No one mention other word than this. So the SNP is the best word in this scenario to take a SNP. And you didn't give her the scan or the ultrasound guided. I mean the scan guided because it's doing by scan, not blindly. You should reassure her by this way. You didn't say at all about the scan. We are using jelly scan or some image to see your kidney, and we'll go a needle through your skin after numbing the skin area under the kidney. Then we will take the snip and getting out smoothly with no complication, as we have the expert hand and the skilled professional doctors, as you said. So before, you can say about before numbing the area, cleaning the skin, uh, confirming that you are not taking any blood thinner medication, not as a question, as instruction. So don't ask at the end, do you take aspirin or whatever blood thinner? You can say, we will be sure that you are not taking any blood thinner medication. And as you said, we will do some investigation to be sure that your bleeding profile is in normal level or normal range to be safe from any complication like bleeding. So this is before the investigation, the preparation, the numbness, the cleaning. This is before. Then during, if you want to draw, you can draw. You said I will draw, but you didn't draw. You started it well, but you didn't draw. In the paper, you will draw the kidney or the back, and this is the our machine. The needle will go through the skin to the kidney, and we will take a very small snip. Then we will go out smoothly without complication under the image or under the view of our scan machine, which can help us to guide the needle till the kidney without injury to the other nearby organ or to the kidney itself. Okay, this is during. Okay, after you said the after you have the scheme well, Dr. Abdullah, but you should train more about how to explain. Then the after you said about the recovery. Yes, we will keep you under the recovery for the vital to check for the vitals, for any signs of bleeding, for any signs of yes, blood pressure and pain. Yes, you can say we'll be sure that you are not feeling any pain. This is after. Then after, before, during, and after, then the possible complication. As you said, the bleeding, the infection, and the kidney damage, not the kidney, you can say nearby organ damage or injury. And we will be sure that we will not have this complication because our team are professional, skilled, highly qualified, frequently doing this procedure every day and for every hour. We are doing a lot of this procedure. This is for reassurance. Then you ask her good question. Are you agree with this? She said, no, doctor, I can't do it. And this time you address her why you don't want. She said, I'm afraid, doctor. So you can reassure her again why we, as I said to you, we are using our precaution, we are doing it frequently, we are using the scan, and so on. Then if she's still refusing, you can tell her if you want to arrange a meeting with my consultant to explain more. He has the way how to explain more professional than me, and he has the way how to convince you. If she said, okay, tell her I will arrange the meeting as soon as possible. If she said, okay, doctor, I am okay, or I am thinking, or I will think, tell her, okay, I will hand you the consent form. Read it carefully. You will read, yeah, you will find everything in this consent, the complication, the preparation, everything about the procedure. Then at the end, you can sign your approval or your signature at the end of the paper, and we will arrange the procedure time or date, and we will update you about that. Then the social smoking, alcohol, and the job, leaflet brochure about the procedure, then thank her and close the meeting. But don't ask about any medication you are taking or any warfarin or any methylene or any aspirin. As I said, by instruction, we will be sure that you are not taking any blood thinner medication. So this is not taking history. But if you ask, do you take or are you taking, this is history taking, and it will be against you. Okay.
And, I didn't
So,
ask about pregnancy, obstetric and
sorry.
obstetric history here.
No, why obstetric history? Why?
Okay, it's not part.
No,
Okay.
no. No, if you are talking about medical management, yes, steroid or some medication which can affect the pregnancy. But you are doing the procedure in a couple of days. Maybe after how many days you will have the date for the biopsy. So I
Okay.
don't think it's wise to ask about pregnancy because the procedure itself it will not harm the pregnancy, but if the patient pregnant already, they will not give her this decision for renal biopsy. Why they will do the renal biopsy while she is pregnant? It's not wise at all to decide this procedure while she is pregnant. She can do it after delivery. So why they will tell you to do? And why you will ask her if she's pregnant now? It's not wise to give her the appointment or the decision itself. Okay?
Yeah.
Yeah. Thank you,
Okay.
Dr. Abdullah. Any question?
Thank you. Thank you. Thank you so much.
Okay, thank you, Dr. Abdullah. Let's read the comment, Dr. Rhoda. If you agree, sign consent. Yes, this is very important. The consent in this scenario is crucial. I think maybe 30 or 40% of the mark depend on the consent. Because if you get out from this meeting without the consent, means failure of the task. Because you should go out with the consent signature, not only sitting with her and get it, unless she is refusing. But if she agreed and you went out without signature, so where is the consent? Where is the approval? Where is the consent? I think they will minus you. Always don't forget in any communication scenario, NDT, yes, follow up and safety netting. Yes, I agree with Dr. Roda. This is for any scenario. Show the examiner that you are caring, you are following, you are taking care, you are giving appointment even for nothing. Just we will give you appointment for updating you. What update? Nothing about updating the result, updating the follow up, updating the complication. Just to show the examiner that you are caring. But yes, this is what we are doing in real life. If you have patient in OPD, after finishing giving the medication prescription, you will give her appointment after 3, after 4, after 1 year, but you are giving her a follow-up and appointment. So this is one of your tasks in any outpatient clinic to follow up the patient, not only giving the medication and leaving him going home. Okay, for any concern, when asked, is it serious? Appreciate concern, yes, sympathy, they say this condition is serious if not treated. Excellent, positive plus positive rest, assure we are going to treat you properly and keep you on good follow-up. Yes, I agree with you, Dr. Roda. Instruction after procedure, avoid vigorous exercise after procedure beside the safety netting. I agree. We can advise for diet in nephro case in multidisciplinary team. Yes, I agree if there is counseling about disease. But now you have specific and particular task. It's a procedure. You should come out from this meeting by consent and understanding the procedure well, the side effect, the complication, the preparation, even the follow-up, the result, the driving home, who will take home, sick leave, anything related to a procedure in the same day of procedure, it will be appropriate. But in the long term, like dietitian, I don't find time to explain you should take a diet, particular diet, or to mention the dietitian. I don't think this is my opinion. You have something is current. Meanwhile, in this time for the procedure itself, why I will talk about the future plan. Yeah, thank you, Dr. Rola. Yeah, so no time. If you have time, I agree. But I think if you went through before, during, and after social safety netting and red flag, I think you will not have time to explain a further management plan. Yes. Thank you, Dr. Roda, for the comments. Any other question, any comments? Yes, another advice, Dr. Abdullah, try to be more faster. I'm always, yes, advising speed, speed up the way of convincing and chatting with the patient. Because the time is short.
Yeah.
Before, I agree with you. If you have the previous time scenario, which is 16 minutes, the previous what's
All
called,
right. Yes.
yeah, a previous way before, it was long time for the communication. I think you can talk with the patient till you will not have time, yes, to talk.
Yes.
But in this scenario, it's like target. Be target and try to speed up your talk to convince and to get out with the result, with the consent, with the approval, with the understanding. But in the 16 minutes way, you can talk slowly to consume the time, to utilize your time well, and to finish the scenario in slow motion. But in the 10 minutes, you should finish your task before 2 minutes, not in the 10 minutes, before 2 minutes, because you might have separate concern. You must address it before end the time. If you didn't address the concern, you will minus the case or minus the mark because there is concern for any scenario. 2 minutes. I will try to remind all candidates 2 minutes remain because 2 minutes means concern, concern, concern. Address the concern because the concern has a mark. If you didn't ask the concern, you will not have the mark of the concern. If you didn't address the concern, you will not have the mark for the concern. So please try to finish the scenario and the task at 8 minutes, whatever you do. Okay?
Yeah.
Okay. Thank you, Dr. Abdullah. Thank you, Dr. Rasha. Nice day. I will try to give you another communication scenario, both of you, Dr. Abdullah and Dr. Rasha.
Inshallah.
Yeah, the day after tomorrow. Try to be more confident, and because I know Dr. Abdullah have a seat.
دكتور باسم،
Yes.
بس عندي إضافة صغيرة كثير لما كان عم
Sure,
يسأل
convince.
concern تبع is there any alternative.
Yes, I agree. Yes.
طيب علقتوا عليها ولا لا؟
Actually, the time was up. That's why I didn't comment on this alternating.
إنه لا، قبل حتى قبل ما يخلص وقته، فقالت له إنه في bleeding و it seems to be dangerous ف is there any alternative. فبتذكره جاوب بس he didn't answer her concern.
Yeah, he didn't address the concern, and I didn't write also this concern. Yes. Please,
he
Dr.
was
Hind,
just
yes, you can comment.
فيعني شوف ما شاء الله كل شيء قلتوه كان ممتاز، لكن ترى تركة الالترناتيف دائما بنهرب منها دائما. فهي should tell her that yes, there is always some other options for the diagnosis. بس biopsy is the most effective or most helpful for us to start the treatment, okay? Because we will be able to see the tissue under the microscope and do correct grading for your disease and prescribe for you the correct medication. فهلا alternatives طبعا لأن هي إذا رفضت فيعني we will not tell her you will stay without treatment. The alternative is always there. تمام؟ بس it is less effective and it will not give us the definitive results مثل البيوبسي. تمام؟ بعدين بيكمل نفس الطريقة اللي كان عم يعمل فيها إنه to try to يعني يخفف عليها أعراض البيوبسي. Make it easier for her to accept. تمام؟ ما نهرب من الكونسيرن. اتفقنا؟
Yes, agree, Dr. Thank you so much. I thought maybe Dr. Abdullah couldn't convince her. That's why she was worried and she didn't agree. But if he convinced,
concern is always asked. إنه دائما they are
you're right.
seeking some alternatives.
Yes, you're right.
And if they can escape from this, it's better for them. But we should really يعني part of convincing إنه no other option or no other good option as this one يعني.
Yes, agree, agree. We should be brave to answer this question without fear. Yes, there is alternative, but the best way for your diagnosis is to do this procedure. However, this is the decision of the consultant, and he see that this is the proper way to diagnose your disease, your complication, or your side effect, or whatever the case. But there is alternative, always there is. But the best way or the best procedure is what mentioned by the or what decided by the consultant. Is it like that, Dr. Hind?
You are most welcome, Dr. Bassem.
Yeah, okay, thank you, Dr. Hind. Yeah, we miss Dr. Hind, yes. Always we are missing her and her comments. But we always give her the excuse for her either work or her social issue. But any time you are welcome, Dr. Hind, anytime. And your comment always, yeah, your comment always valid. Thank you, Dr. Hind. Thank you, Dr. Rhoda. Thank you all. Dr. Abdullah, Dr. Rasha. I will give you again the day after tomorrow for communication, Dr. Rasha and Dr. Abdullah, just to be in the same, I mean, the idea recent discussed, and we'll discuss another scenarios to be more professional, inshallah, and to pass the exam. Any question before
Thank
ending?
you so much.
Yeah, okay. Inshallah, after the day after tomorrow will be the time. Thank you all. Yeah, thank you all. We'll end the record, then we'll see you tomorrow. Good luck and good night. Assalamu alaikum.